Am I audible and visible? Let me know. Let me check. Let us start our session. Welcome to Unacademy Future Doctors. I myself, Dr. Dipti. I'm MD, PhD Physiology. I'm Associate Professor and I'm educating MBBS nursing and physiotherapy students. I have more than 17 years of teaching experience. Yes, nursing and physiotherapy students. Let me explain about our subscription. In Plus subscription, you can access live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access the question bank, which is having more than 25,000 questions. You can compete in live tests as well as quizzes, and within a short period of time, within 12 months, we are coming with our printed notes. Second is iconic subscription. Here in iconic subscription, you can choose best from two of the best. Okay. So which are these two? One is Unacademy and Prep Ladder with Unacademy, and second that is Unacademy and Prep Ladder with Prep Ladder. Characteristic features of first one that I have already discussed. Characteristic features of the second that is Unacademy and Prep Ladder with Prep Ladder. They are here you can access clinical and integrated essentials. You can get video lectures from the Dream Team. You can have Question Bank 3 with active guidance, system tags, and much more. Also, you can get rapid revision and snapshots, treasures, and 2021 Dream Notes. So, please get your subscription. You can have Plus subscription or Iconic subscription on your mobile, and you can use my code DIPTI10 to get 10% discount. Longer the duration of your subscription, cheaper are the rates. So if you are first MBBS student, I suggest that you can go for longer duration plans. Okay? Now, next announcement is in this week we have our NEET PG combat, that is on November 28th at 5 p.m. for 1 hour. Have your this combat in which you have to crack 45 questions. There are 45 questions out there you have to crack, and you can get a chance to win 100% scholarship on Plus subscription. Okay. Top ranker also can get a chance to win Amazon vouchers up to rupees 20,000. So you can say that a big surprise awaits for you. Grab it. Again, dates, just notify the dates, that is November 28 at 5 p.m. and enroll now. You can also use my code to enroll freely. Now, here again you can see, as I have already discussed, rank 1 get 100% scholarship on the Plus subscription, second to 10th rank get 75% scholarship, 50% scholarship that is given to 10 to 11 to 50th rank, and 51 to 200 rank individuals or students, they'll get scholarship up to 25%. Okay. So this is about our NEET PG combat. Now, let us come to our topic. Today's topic is platelet and hemostasis. Okay? Now, what is platelet? ब्लड में we have three types of cells. Three types के cells है, ठीक है? Red blood cells, white blood cells, platelet. So सबसे छोटे वाले जो cells है, they are our platelets. ठीक है? So these are small, colorless. दूसरा non-nucleated, nucleus is absent, and refractile bodies. These are derived from megakaryocytes. So megakaryocytes are precursor of platelets. Okay. Functions, they are important for hemostasis. Hemo means blood, stasis means stoppage of blood loss. Normal count of platelet is about 2 lakhs 2 lakhs to 3 lakhs 50,000 per cubic millimeter. Okay? Platelet formation, platelet production, that is controlled by the factor. Like RBC production, the factor is erythropoietin. Here it is thrombopoietin. Some other cytokines are also there. They control platelet production. Okay? Now, morphology of platelet, how do they look? As we have discussed, they are small, colorless, non-nucleated, refractile bodies are there. The diameter, smallest, as I told you, smallest cells. So the diameter is 2 to 4 micron and volume is 7 to 8 cubic micron. Okay? So, sorry, now, what is the shape of platelet? Shape is different. Active platelets. What is the shape of active platelets? They are spheroid or spherical or roll shaped. Okay? Inactive platelets, they are oval or disc shaped. Okay? And some unusual shaped platelets are also present. Now, next is structure. Like other cells, platelets, they also have cell membrane. You can see here, suppose we are talking about one cell. So cell membrane is there here. Cytoplasm is there. Organelles are there. Important one is microtubule, one of the organelles. Now, membrane. This is cell membrane. This is the structure of cell membrane. This one. It is about 4 to 6 millimeter, 4 to 6 nanometer thick. This one. Yes. And cell membrane, like other cells, the membrane is having lipids, carbohydrates, and proteins. Okay? And another important things present here, that is glycoproteins and phospholipids. Important substances present in the platelet cell membrane, that is glycoproteins, and they have specific functions. Phospholipids. Okay? Now, उनके फंक्शन क्या है? ग्लाइकोप्रोटीन यहाँ पे आप देख सकते हैं. You can see here are platelet cell membrane having glycoproteins. These are glycoprotein receptors and glycoproteins are there here. Okay? So, what is the role of glycoprotein? These glycoproteins, they prevent adhesion of platelets to normal endothelium. When the endothelium is normal, this is not normal, this is exposed. You can see here, suppose this is the endothelium normal. And here are the collagen. Here, this is the blood vessel. This is the endothelium. These are platelet inside the vessel. Okay? So, this glycoproteins, they prevent adhesion of these platelets to this normal endothelium. But when the endothelium is damaged, when suppose this is damaged, this one, when it's destroyed, ruptured, so this platelets, glycoprotein, they allow these platelets to attach to this damaged endothelium. Okay? Another is these glycoproteins, they are the receptors for binding of thrombin, here you can see, and ADP, adenosine diphosphate, this one. Okay? Next is phospholipids present in the cell membrane. So phospholipids are the precursor for the synthesis of thromboxane A2. Here it is written thromboxane A2. And also other prostaglandins. Thromboxane A2 and other prostaglandins. Thromboxane A2 and other prostaglandins. Okay, done. Next one, microtubules. Okay, you can see here. This is microtubule. You can see here in this diagram. These are microtubules. These microtubules, they form a ring in the cytoplasm and this is present below the cell membrane. You can see here below the cell membrane, we have microtubule. This microtubule consists of tubulin protein. This is made up of tubulin protein. Okay? And their functions are, they provide structural strength to the platelets. Structural strength is provided. You can write down along with to platelets. Okay? Now, other organelles like other cells are also present. You can see here like Golgi apparatus, mitochondria, endoplasmic reticulum, microtubules, microfilaments, as well as proteins, hormones, and enzymes. They are also present in the cytoplasm of the platelets. Now, next is proteins, which are important proteins present in the platelets. They are actin and myosin. What is the role of actin and myosin? They are important for contraction of the platelets. Contraction of platelet. Okay. And thrombosthenin, that is important for clot retraction. Clot retraction. Whatever clot is formed, that gets retracted by the protein thrombosthenin. Next is von Willebrand factor, which is produced from platelet as well as endothelium, and that is important for adherence of platelets. Adherence of platelets. Okay. Another thing secreted, protein secreted by the platelet, that is fibrin stabilizing factor, which is clotting factor. Clotting factor. We will discuss different clotting factors. Another protein is platelet derived growth factor, that is important for growth of blood vessels and wound healing. That is the role. And wound healing. Okay. And platelet activating factor, that is important for aggregation of platelets. Aggregation of platelets. Okay. So this is about proteins. Okay. This again, you can see the granules, they contain all these proteins. Okay. Present. You can see here names are given, like platelet derived growth factor. Here it is. Now, next are enzymes present. Important enzymes present in the platelet, that is ATPase. Now, what is the role of ATPase? That is to degrade ATP and produces ADP. Okay? As well as platelets, they have enzymes for the synthesis of prostaglandins. Certain hormones are also synthesized from the platelets. There is one comment on one chat is there, madam, please start CVS and CNS as they are quite difficult. I'll try to complete. After this, I'll definitely start. Okay. Definitely, I'll start CNS. And if you have a difficulty in some of the particular topic also, then also you can uh, you can write me on this chat box. Huh? I will definitely. Now, hormones are also synthesized by platelets, and they are adrenaline, serotonin, and histamine. Now, next is normal count. Normal platelet count, we have discussed. Values are variable, but it should not be less than 1,50,000. Our value in our book, that is 2 lakhs to 3,50,000 per cubic millimeter of blood. पूरा unit के साथ लिखना है. Variations in the platelet count, age-related variation, it is less in infants. Infants में कम होता है platelets. Okay? At the age of 3rd month, this value reaches adult level. Okay? Gender, males, females में same रहेगा, no difference. High altitude, platelet count increases. Like erythropoietin, thrombopoietin is also secreted. Okay? After meal, also platelet count increase. Okay? Now, pathological variations. Pathological means because of some disease, when platelet count increases or decreases. So, which are the pathological variation? One is thrombocytopenia. Penia means decrease platelet count. Okay? So, decreased platelet count, which are the causes? Because of acute infection, commonly in the viral infection, platelet count decreases. Dengue fever में commonly platelet decrease. Other virus is smallpox. Smallpox is eradicated. Okay? Chickenpox, typhoid, tuberculosis, and purpura. Thrombocytopenic purpura, we will discuss. What is it? Thrombocythemia, that is also known as thrombocytopenia. So, thrombocytosis. That was thrombocytopenia. This is thrombocytosis, means increased platelet count. And causes are in allergic condition, in surgery, surgical operation, because after surgery there is bleeding, and as there is bleeding, hemostasis required, and for hemostasis platelet are required, so platelet count increases. Splenectomy also platelet count increases because spleen destroys platelets. So when spleen is removed, then platelet count increases. And after trauma also, there is bleeding, hemostasis. For hemostasis, platelets are required. Now, properties of platelets. First property is adhesiveness. You can see here. Adhesiveness means they adhere to the endothelium as well as to each other. There are certain factors which are required for adhesiveness, and they are, you can write down names also, these factors. They are collagen, ADP, P-selectin, thromboxane A2, thrombin, calcium, and von Willebrand factor. These all factors are required for adhesiveness of platelets. Then aggregation. Aggregation means platelets are aggregated, bind to each other. So for adhesion and aggregation, for aggregation particularly, ADP and thromboxane A2 are required. Okay? For agglutination, platelet agglutinin factor is required. Okay? Now, functions of platelets. So first is they play an important role in hemostasis. Hemostasis means stoppage of bleeding. Hemo means blood. Stasis means stoppage. Stoppage of blood loss. There are various steps in hemostasis. Okay? So for hemostasis, one step that is we will discuss vasoconstriction. For vasoconstriction, there is release of 5-hydroxytryptamine from platelets. That is important. Okay? Second thing is formation of, you can see this one, 5-hydroxytryptamine. Second thing is activation of platelet. That is also required for hemostasis. Activation of platelets. Okay? And for that, there is release of ADP and thromboxane A2. And that forms platelet plug. I'll show you. You can see here. You can see here, this is a platelet plug which is formed. Okay? So platelet plug is formed, and for that this ADP and thromboxane were required. So first function platelet का हो गया, role in hemostasis. Second function, role in blood coagulation. This is temporary plug. टेम्पररी प्लग है ये वाला, तो उसका फिर परमानेंट प्लग बनेगा, that is blood coagulation. So for that also platelets are required. Okay? Now, third is role in the clot formation here. Okay? For formation of clot, and next is clot retraction. Platelet is having actin, myosin, and thrombostatin. They are required for what is clot retraction? We will discuss. This all they cause retraction of clot. Okay? Another function of platelet, that is role in the repair of ruptured vessel. Whatever vessel is ruptured, suppose here. So this platelet, they release platelet derived growth factor, which is important for growth of blood vessels. Okay, so this ruptured vessel gets repaired. And in defense mechanism also, this agglutination property is important. It agglutinate antigen. Okay? And they help in defense. Okay? Now, development of platelets. Okay? So here you can see, as we have discussed, they are derived from megakaryocytes. These are megakaryocytes. Megakaryocytes में से derived हुए. Okay? You can see here. सबसे पहला जो सेल होता है ना, this one हमने डिस्कस किया था, स्टेम सेल्स बोलते हैं जिसे, pluripotent hemopoietic stem cells. So stem cells है, from which we have colony forming blastocyte and lymphoid stem cells. We have discussed this. Colony forming blastocyte again converted into colony forming unit erythrocyte, colony forming unit megakaryocyte, and colony forming unit granulocyte monocyte. Okay? From this megakaryocytes, you can see here, there is formation of platelets. Okay? Pseudopodia develop and platelets are released. So platelet production, that is from megakaryocyte. And this production of platelets is increased by these factors CSF and thrombopoietin. CSF, that is colony stimulating, this is colony forming, and this is colony stimulating, याद रखना है, stimulating factor. Okay? And it is secreted, कौन secrete करता है इसे? Monocytes and T lymphocytes. Monocytes and T lymphocytes. Next is thrombopoietin. Thrombopoietin is produced in liver and kidney. Is that? Now, lifespan of platelets. Lifespan of platelet, that is about 8 to 11 days. Here you can see 8 to 11 days. And after they finish their life, they are destroyed by tissue macrophages present in the spleen. So whenever there is splenomegaly, megaly means enlargement of spleen, more destruction of platelets. So platelet count decreases. Platelet count decreases. And when there is splenectomy, spleen is removed, then platelet count increases, because now spleen is not there, so platelets are not removed. Okay? Now, next topic we will discuss, that is hemostasis. As I told you, hemo is blood and stasis means stoppage. So how can we define it? Here, write down the definition, very important, because when the question is hemo, one of the important question may be asked in your university exam. Hemostasis. So what is hemostasis? That is spontaneous, you can write down this definition, spontaneous arrest of or prevention of bleeding from injured or damaged blood vessel. Very important word comes by physiological process. Okay, this is the definition: spontaneous arrest of or prevention of bleeding, injury or damaged blood vessel by physiological process. ठीक है, it has 3 steps. फोर्थ वाला भी आएगा, क्लॉट रिट्रैक्शन. कुछ बुक में 3 दिया हुआ है, कुछ में 4 दिया हुआ है. So 1, that is vasoconstriction. Second, platelet plug formation. Third, blood coagulation. And fourth, clot retraction. We will discuss one by one. Okay. So now, first is vasoconstriction. So what happens? You can see here, whenever there is injury to the blood vessel. Okay. First step is here. This is vasoconstriction is the first step. Okay. And this is local blood vessel gets constricted. Now, how this happen? कैसे होता है ये? So whenever you can see here, this is normal endothelium. This one. This is damaged endothelium. When this damaged endothelium, when the endothelium is damaged and platelets, they are exposed to collagen fibers. यहाँ पे जो collagen होता है ना, वहाँ पे expose होते हैं blood vessel के wall में. Okay? Because of this platelets, they get adhere to the damaged endothelium and they get activated. अभी next step आएगा सबसे पहला activation of platelet. Okay? And this activated platelets, they release 5-hydroxytryptamine और जिसे हम कहते हैं serotonin, 5-HT, and this 5-HT causes vasoconstriction. Okay? Next is von Willebrand factor. Here, it is like a bridge. It forms a bridge between glycoprotein of the platelets and collagen fibers. Okay? So this is first step we have discussed, vasoconstriction. Second step is platelet plug formation. So here you can see, now platelets, they get activated. Now these platelets, they release these two things, ADP and thromboxane A2. Now this ADP and thromboxane A2 increases adhesion of platelets. Platelets को stick करता है एक दूसरे के साथ, ऐसे करके. And there is formation of platelet plug. Okay? So now this plug here, ये जो plug है वो temporary plug है. Now this temporary plug is converted into permanent plug and the process is blood coagulation. So here you can see all सभी steps यहाँ पे दिखाए हुए. First one, damage to the blood vessel. Okay? उसके बाद आएगा vasoconstriction. Second thing, platelet plug formation. This is second step. And third step, blood coagulation. So ये जो plug है, this is temporary plug. And this is permanent clot. Okay? So here blood coagulation is not a simple process. It is a complex process because various clotting factors, they get activated. And there is positive feedback mechanism of this clotting factor. What is this positive feedback? एक clotting factor दूसरे को activate करेगा, second first वाला वो next को करेगा. Not 1 2 3 numbers are different. There are about 13 clotting factors. दो नए भी invent हुए हैं. Okay? So this clotting factors, the numbers are given according to their discovery. जो पहले हुआ है, the number was 1. Okay? And they form permanent plug. And this permanent plug is made up of fibrin meshwork. We will discuss what is it. So now, what is blood coagulation? Definition is, it is the process in which blood loses its fluidity. Fluidity is lost. And it forms jelly-like mass. It forms jelly-like mass. When this happens, when blood loses its fluidity and becomes jelly-like mass, when the blood shed out of the vessel. When blood comes out of our body, it loses its fluidity and it forms jelly-like mass. Okay? And this mass is made up of fibrin meshwork. Okay? Now we discuss about clotting factors. Try to remember all these factors. Okay? Let us enumerate first. Clotting factor number 1 is fibrinogen. कुछ भी आपको ट्रिक बना लेना है या फिर सबसे पहला जो आएगा ना वो लास्ट स्टेप है F. Then TTC. Okay? I have remembered in this way. So P means prothrombin, T means tissue factor, C means calcium. Okay? Next आएगा number 5, labile factor. Number 6, no clotting factor. 6 number का कोई clotting factor नहीं. 7, stable factor. अगर labile और stable factor नाम याद नहीं रह रहा है तो that is proacylorine and pro-converting. You can remember. Factor 8, anti-hemophilic factor A. Okay? Factor 9, anti-hemophilic factor B. Other name is Christmas factor. Okay? Factor 10, that is Stewart power factor. Stewart little tha na? You can remember by that name, 10 number. 11, anti-hemophilic factor C. 12, Hegman factor. 13, fibrin stabilizing factor. Okay? So 13 factors are there. Other 2 new factors are there available, and they are, you can see, one that is prekallikrein. और दूसरा नाम है उसका फ्लेचर्स फैक्टर एंड हाई मॉलिक्यूलर वेट काइनोजन और फिट्जगेराल्ड फैक्टर। तो ये दो नाम भी याद रखने हैं, फ्लेचर्स फैक्टर एंड फिट्जगेराल्ड फैक्टर। नाउ blood clotting, one of the very important topic. Blood clotting, that is in 3 stages. Number 1 stage, that is formation of prothrombin activator. Here you can see this prothrombin activator is formed. This prothrombin activator is activated by extrinsic pathway and intrinsic pathway. You can see here these two pathways are there. Okay? And now this prothrombin activator which converts prothrombin into thrombin. This one, prothrombin is converted into thrombin. And third step, that is fibrinogen is converted into fibrin. Okay, so prothrombin activator, first step, second step, that is prothrombin to thrombin, and third step, that is fibrinogen to fibrin. Okay, now so ये जो first वाला step है ना prothrombin activator, that is by 2 ways. एक है one is extrinsic pathway and second one, that is intrinsic pathway. These two pathways are there. Okay? Now let us discuss first one, extrinsic pathway. Okay? तो extrinsic pathway में सबसे पहला step क्या होता है? There is tissue trauma. Tissue trauma causes release of tissue factor. Factor number 3 सबसे पहला आएगा. Okay? Factor 3 के दो parts है. One, that is glycoprotein. Tissue factor has glycoproteins. And second, that is phospholipids. Okay. Now, so ये glycoprotein वाला है this along with factor number 7. Sorry, this one, factor number 7. So 3 with 7. 7 gets activated. Okay. This two they activate factor number 10. Easy याद रखना है तो हम ऐसे बताते ना 3 plus 7 is equal to 10. तो सबसे पहला आ गया हमारा factor number 3. Then आ गया 7 and then it activates factor number 10. इसके साथ में कैल्शियम तो चाहिए, 4 नंबर फैक्टर दैट इज रिक्वायर्ड एवरीवेयर. कैल्शियम आपको सभी में लिखना है एक्सेप्ट इंट्रिंसिक पाथवे के फर्स्ट 2 स्टेप्स में कैल्शियम नहीं आएगा. ठीक है. तो दिस इज फैक्टर 10 जो एक्टिवेट हो गया. नाउ दिस फैक्टर 10 प्लस कैल्शियम हियर, सॉरी, प्लस कैल्शियम दिस वन plus factor number 5. These three activated factor 10, calcium and factor 5. They activate prothrombin activator. Okay. So ये हो गया हमारा extrinsic pathway यहाँ तक, prothrombin activator तक. ठीक है. तो easy याद रखना है. तो 10 के बाद आ गया 10 divided by 5. 5 factor हो गया ना यहाँ पे. तो क्या हो जाएगा 10 divided by 5 is equal to 2. तो 2 is our thrombin. प्रोथ्रोम्बिन एक्टिवेटर क्या करेगा? प्रोथ्रोम्बिन को थ्रोम्बिन में कन्वर्ट करेगा. प्रोथ्रोम्बिन इज आवर फैक्टर नंबर 2. तो इजीली यू कैन रिमेंबर फैक्टर 3, देन 7, 10, 5 and 2. So this is extrinsic. Second आएगा intrinsic pathway. Here what happens in intrinsic pathway, whenever there is rupture to the blood vessel and blood vessel is exposed, and sorry, the blood and platelets are exposed to collagen fibers. Here जो blood vessel में collagens होते हैं, ठीक है, वहां पे exposed हो गया. ठीक है, यहाँ platelets है हमारे. Then this intrinsic pathway gets activated. सबसे पहले क्या होगा? Whenever there is trauma or contact of platelets with the collagen, सबसे पहला आएगा factor number 12 that gets activated. 12 number activate हो जाए. Okay, this is factor 12. 12 along with high molecular weight काइनोजन and प्रीकैलिक्रिन, जो हमारे लास्ट 2 फैक्टर्स थे. ठीक है, इसके साथ मिलकर फैक्टर नंबर 11 को एक्टिवेट. यहाँ पे रिवर्स जाना है. 12 देन कम्स 11. ठीक है. तो एज आई टोल्ड यू, ये नंबर 1 और 2 ये 2 स्टेप्स में कैल्शियम नहीं आएगा. इसके बाद सभी स्टेप्स में कैल्शियम लिखना है और एक्सट्रिंसिक पाथवे के सभी स्टेप्स में कैल्शियम आएगा. नाउ factor number 9. Factor 9 activates, sorry, factor 11 activates factor 9 here. Factor 9 with factor 8, here you can see, they activate factor number 10. Okay, so यहाँ रिवर्स जा रहे 12, 11, then आ गया हमारा 9, then आ गया 8 और 10. Okay, यहाँ पे this 10. Here this activation of 10 requires platelet phospholipid. So platelet यहाँ पे इनका रोल आ गया intrinsic pathway. 12, 10, factor 10 plus factor 5 जो मैंने आगे भी बताया था सेम है 5 calcium and they activate prothrombin activator. This prothrombin activator converts prothrombin to thrombin. तो ये हो गया हमारा intrinsic pathway. So what is the difference between extrinsic and intrinsic pathway? Extrinsic pathway वो rapid है, fast है, within second start हो जाएगा, whereas intrinsic pathway is slow. It requires 3 to 6 minutes to start. Extrinsic pathway, that is started with factor number 3, tissue thromboplastin, whereas intrinsic pathway by damage to the blood vessel endothelium. Okay, now so we have discussed up to this stage, this one, prothrombin activate. Okay, next step आएगा step 2, stage 2, that is now this prothrombin activator plus calcium ions plus platelet phospholipids, they convert prothrombin to thrombin. Okay, another important thing here, there is positive feedback mechanism. How? You can see more the thrombin is formed, more will be the activation of factor number 5. More the factor 5, more will be the formation of prothrombin activator. More prothrombin activator, more the thrombin. So ये पूरा positive feedback हो गया. This one. Okay. Stage 3. Now our thrombin is formed यहाँ पे. ठीक है. Now this thrombin converts fibrinogen to fibrin. Fibrinogen is inactive. From this fibrinogen, when last 2 pairs of polypeptides are lost, then it is converted into fibrin. This fibrin is monomer. Monomer means single chain. When it gets polymerized, it forms fibrin polymer. This is, and then there are cross linkages of this monomers. You can see here, like, and they form meshwork. And this meshwork is stabilized by factor number 13, that is fibrin stabilizing factor. Okay? Stable fibrin clot is formed. Now, blood clot. What is blood clot? Blood clot, that is mass of coagulated blood. It is mass of coagulated blood. This coagulated blood contains what? It contains our blood cells, RBCs, WBCs, platelets, plus fibrin meshwork. Mass of coagulated blood, which contains blood cells and fibrin meshwork. So it can consist of blood cells and fibrin meshwork. Now next is scab. What is scab formation? That is external blood clot. What is the function of scab? Suppose you can see your blood vessel of the surface of skin gets damaged. So there is formation of here like this external blood clot, that is known as scab. What is the function? That because this scab is there, this opening of the blood vessel is closed. So now there is no more bleeding. So it prevents blood loss. Okay? Now, after 30 to 60 minutes of formation of these clots, 30 to 60 minutes after, now this clot gets retracted, retraction of the clot. Okay? Now, this is because of our platelet thrombostatin. That is the protein present we have discussed. Plus actin and myosin. They are responsible for clot retraction. Next is serum. Sometimes a fluid comes out after this clot retracts, and that is serum. So serum is equal to blood minus plasma, plasma minus clotting factors. That is, it is like plasma, but it is not having clotting factors because they are used in blood coagulation. Okay? Now, next important mechanism, that is lysis of the clot. Suppose you can see here, this clot is formed, fibrin clot. Now next step is, it is to be removed. Otherwise what happens, because during the whole day multiple vessels are ruptured in our body, suppose if I am doing just a like single movement, then also multiple vessels they get uh, breakdown and clot gets formed. Now next step is this clot must be lysed, and for that the mechanism, that is fibrinolytic mechanism. The protein for that, that is fibrinolysin. Another name for it is plasmin. Okay? Now this plasmin or fibrinolysin that is normally present in inactive form, you can see here in this diagram, which is known as plasminogen. This plasminogen is converted into plasmin. Now what is the action of plasmin is this lysis of this fibrin clot. Okay? So this is fibrinolytic. So plasminogen activator. Plasminogen activator, what is the role of plasminogen activator? That is plasminogen is converted into plasmin and it is released by various lysosomal enzymes also. Blood is also having plasminogen activator. Tissues, they also contain plasminogen activator. There are inhibitor of this plasminogen activator, that is TPA inhibitor, tissue plasminogen activator inhibitor, and factor 5 and factor 8. They inhibit this plasminogen activator. Now, how this plasminogen activator gets activated, this diagram is very important. Here, important is inhibition is inhibited. जो inhibit करना है उसको inhibit करते हैं. So there is activation. Remember here you can see whenever there is intravascular clotting, clotting inside the blood vessel. So what happens here in the intravascular clotting? There is here there is thrombomodulin. Thrombomodulin is present. This thrombomodulin binds with thrombin. You can see here. This thrombin thrombomodulin complex is formed. Okay? And this complex causes activation of protein C. Now, along with protein C, there is another protein is present, protein S. So this activated protein C, how does it act? It inactivates factor number 5 and 8. This 5 and 8 we have discussed in the previous slide. 5 and 8 are inhibitor of plasminogen activity. So inhibitors are inhibited means plasminogen is activated. Try to remember this thing is important. So inactivation of factor 5 and 8 as well as inactivation of inhibitor of tissue plasminogen activator here, this one. So these two inhibitors are inhibited. So means negative, negative, the effect is positive. Okay. So again I repeat, you can see here this protein C, activated protein C inhibits inhibitors of tissue plasminogen activator and also inactivates factor 5 and factor 8. Okay, this is important. Now, so what are the action of plasmin? You can see here, this is plasmin. Plasmin causes lysis of the clot. Okay? So in myocardial infarction, what happens in myocardial infarction? There is formation of blood clot which blocks coronary vessels. And when these coronary vessels are blocked, what happens? There is no blood flow, that is infarction. And for lysis of this blockage, clot lysis is required, this one. Okay? So this fibrinolytic enzymes, one of the enzymes, streptokinase, that is used for the treatment of early myocardial infarction. Now, next, some applied aspect we will discuss, that is bleeding disorders. Now, what do you mean by bleeding disorders? Here, these are the disorders in which bleeding time or clotting time are prolonged. Important disorders are hemophilia, purpura, and von Willebrand disease. We will discuss. First is hemophilia. What happens in hemophilia? There is deficiency of factor number, here you can see. Hemophilia, that is sex-linked disorder. So sex-linked disorder means the gene is present on the X chromosome. You can see here. So when females having this gene, females are always carrier, because females, they have two X chromosome, and this is sex-linked recessive disorder, means when both the X chromosomes having the gene, then only the disorder is present. And males, they have only one X chromosome, therefore these males, they are affected. Okay, so what is the this clinical feature here? Whenever there is bleeding, you can see here, bleeding starts in normal vessel, it stops within 4 to 7 minutes. This is clotting time. But here in hemophilia, there is no clotting or deficient clotting because of lack of factor 8 or factor 9. When it is because of lack of factor 8, that is hemophilia A. When it is due to deficiency of factor 9, then it is hemophilia B. Treatment given, that is replacement of missing factor, factor 8 or factor 9. Okay. Next is purpura. What is purpura? Here, purpura, the name itself suggests purple. You can see here, this kind of small, tiny hemorrhagic spots are present, purple color. So they are known as purpura. Okay. Here, what is the cause? Because bleeding time is prolonged. There are three, it has three types. One, that is thrombocytopenic purpura, means thrombocyte count decreases, and therefore there is tiny small hemorrhagic spots. Second, thromboasthenic purpura. Thrombocytes are normal, but there is a defect in structure or function. Okay? And third is idiopathic thrombocytopenic purpura. Here, idiopathic means no known cause is there. Okay? Next is von Willebrand disease. Here, in von Willebrand disease, also there is excessive bleeding with small trauma. Here, there is deficiency of von Willebrand factor. And von Willebrand factor, what is it? It is the protein synthesized by endothelium of the damaged vessel as well as platelets. Endothelium भी secrete कर रहा है, platelet also they secrete. What happens here? Clinical feature is both bleeding time as well as clotting time. Both are prolonged. So clinical features of purpura and heme. Okay. Okay. Next small topic is thrombus. What is thrombus? That is intravascular clot formation. Normally, this clot will not be formed. Why? Because our clotting factors are inactive. Okay, clotting factors inactive होते, one cause. Second, endothelium is smooth. Third, blood is continuously moving. Fourth one, anticoagulant heparin is present and antithrombin 3 are present. So in our body, there is no thrombus formation. Now, which are the causes for thrombus formation? If there is any injury to the blood vessel because of any infection or any obstruction, then endothelium is not smooth. So it becomes rough because of infection or injury, damage or atherosclerosis. So that is the cause for thrombus. Second thing, sluggishness of blood flow. Blood flow is reduced because of cardiac arrest or cardiac dysfunction or hypotension. Certain toxins also increase thrombus formation. RBC agglutination also increases thrombus formation, and absence of protein C, because protein C, that is important for inactivation of factor number 5 and factor number 8. So if they get activated, then it increases blood coagulation. So, and there is formation of thrombus. Okay? Now, which are the complications of thrombus? When thrombus is there, it occludes the blood vessel. And when this thrombus dislodged, means removed from this area, it is released in the form of embolus. And it will block different vessels. Like if it goes to pulmonaries, it blocks pulmonary. Cerebral embolus blocks brain vessels, coronary vessels, and that produces ischemia and infarction. These two terminologies are also very important. Ischemia means insufficient blood supply to the tissue or decreased blood flow, that is known as ischemia. And infarction, that is absence of blood flow. Okay? So these are complications of thrombus. Okay? Now, questions, write down questions. These are all the questions may be asked in your exams. Different, same question in different ways. You can have screenshot also. Okay. So questions are explain. I am just reading. You can also write down. Explain structure and functions of platelets. What is thrombocytopenic purpura? Second question, describe stages and process of hemostasis in detail. Question number 3, discuss various phases of hemostasis and abnormalities associated with each. Question 4, define hemostasis, discuss intravascular clotting mechanism. Question 5, discuss mechanism involved in the process of blood coagulation and prevention of intravascular clotting. Question 6, enumerate different clotting factors and describe mechanism of blood coagulation. Question 7, extrinsic pathway of coagulation. Question 8, give an account of positive and negative feedback mechanism taking place during blood coagulation. Question 9, describe the mechanism of hemostasis. Name anticoagulants commonly used in laboratory. Question 10, define clotting. Describe role of liver and vitamin K in clotting. Question 11, blood coagulation test. 12, purpura. 13, describe agglutinogen and their reactions in detail. These are short notes, may be asked. Question 1, platelets. Question 2, organelle present in platelets. Question 3, functions of platelets or thrombocytes. Question 4, endocrine functions of platelets. Question 5, formation of temporary hemostatic plug, platelet plug. Question 6, describe extrinsic mechanism of initiation of blood clotting. And question 6, intrinsic clotting pathway. Okay. So if you like my video, you can like, you can share and subscribe. Okay? And this channel is for first MBBS. My videos are basically for first MBBS university exam going students. So if you have your junior, your family or your friend having first MBBS university exam, please share this video with those students. Okay, that these videos will be very helpful to those students. So please share it with them. Okay, and these all videos are free. You can access freely on our channel. Okay, Unacademy Future Doctors. Thank you.